Thank you for. All right, thank you everyone. Thanks for having us present. So my name is Sarah DeSimone. I am the marketing specialist for High Peaks Hospice, and I'm just honored to be able to represent such a wonderful organization and our care team. So we'll go through a presentation and then we'll take questions at the end, and I will let Kathy introduce herself.
And I am Kathy McNulty. I'm an RN with High Peaks Hospice, and I've been doing hospice care for about 24 years with some breaks in between. So I just like to get out in the community, so I've been tapped to help with some of the in-services. So we're very happy to be here. So thank you for that.
All right, let me take a moment and share my screen. Okay, everyone can see the presentation. So today we are going to be presenting our just organizational awareness. We're doing a big push to educate the general public on hospice. We feel it's a benefit that every family deserves, offering dignity, comfort, and peace at the end of life. So today I'll share the facts about hospice, and this will help allow families to make an informed choice about what is best for their unique situation. Hospice care is focused on helping families cope with what people fear most about dying: being in pain, being alone, losing control, and being a burden to others. Hospice offers families the support needed to be able to care for their loved one at home, surrounded by the people and things that bring them comfort and joy. For patients, hospice care offers emotional and spiritual support and state-of-the-art medical care tailored to the patient's wish to remain pain-free and alert. For families, hospice care eases the burden of caregiving through teaching and assistance with care, emotional and spiritual support, respite time, and resources or referrals for other challenges that a household may face. So most seriously ill Americans do not receive the end-of-life care they want, largely because they do not realize that, number one, hospice care providers are available to come to them wherever they call home, even in rural areas. Two, hospice care is the proven leader in pain management, employing technological advances that have been documented as superior to conventional care. Hospice physicians are specially trained in both pain management and in the medications that they provide. And hospice employs a team of doctors, nurses, social workers, chaplains, and trained volunteers to help the patients and loved ones with their whole range of needs, whether it be physical, emotional, social, and spiritual. It's a very holistic approach. Each patient's primary care provider remains an integral part of the hospice team. The care team, along with the patient's family's input, develops an individualized plan of care to meet each patient's unique needs. So unique to hospice, the patient, their family, and their caregivers that you see in the center of the circle all receive care and support by the care team that's surrounding them. And Kathy will go over a little bit more detail.
And you can see how every person on the outside of that circle is an integral part of the team, as well as the patient, the family, and the caregivers. And we count on every one of them to be part of that team. So for example, we always have the RNs in, who are the case managers. We have LPNs that provide the personal care and also can do LPN things and report to the RNs regularly so that we're keeping tabs. Social workers are critical, the bereavement team, the volunteers, spiritual care, all part of the team, therapists as needed, and then the patient's primary care provider. So all of them are critical to that team and work together with the RN coordinating.
Mm-hmm. Yep, and just once again, I can't emphasize enough, people don't always realize that we're not just providing care to the patient, we really care, and people are always surprised to see how much care is provided to the family and caregivers. It's such a relief. They need that same support as well. So where is hospice care provided? We focus on the comfort and quality of life. So we visit patients where they're most comfortable. Most commonly, this is going to be in the patient's private residence, but it can also be provided in nursing home, assisted living facility, any kind of long-term care facility, actually, a family member's home, anywhere that they call home. So what services does hospice provide? This just kind of goes along with that circle of care. Hospice care includes a wide range of services, all focused on enhancing the quality of life. These range from doctor services to 24-hour access to registered nurses to medical equipment and supplies. It also includes dietary counseling, prescription drugs, and much more. And these, as much as this services list is, this is all in addition to what families tell us time and time again is our most invaluable service, helping patients and their families feel connected, supported, and not alone, no matter what time of day or night it is when panic or emergencies arise. So Americans are clear about their priorities at the end of life. There's research and studies that show that most commonly people are looking for home-based care. They want control over their treatment. They want emotional and spiritual support for themselves and their loved ones. Definitely effective pain management and freedom from financial worries. And the good news is that hospice care offers these services Americans want, and Medicare or health insurance most often pays the bill. Kathy will give us a little insight here.
So just so you are aware, Medicare is the gold standard for hospice care, and the care we provide is the same across the board. There's no difference whether someone's charity care, whether they're Medicare, or whether it's Humana. The same services are provided, and we go by the Medicare standard, which is again the gold standard of care. But all insurances, most all insurances have a hospice benefit, and if not, then we do have charity care that's available for our patients.
Did you want to elaborate on this also, Kathy, about no one wants to think about losing someone they love. And for that reason, it's one of the main reasons families delay discussions about end-of-life care and wait until the final days or weeks of their loved one's life. And often,
it's all, sorry, Sarah. It's always a difficult time coming in, but we have those conversations with patients and families. Occasionally there are families that tell us, don't tell our loved one that they're on hospice. And we really ethically can't do that. Although if the person has Alzheimer's and doesn't know, we're not going to mention that over and over again, and we'll get the power of attorney to sign for them. But it's a very difficult time, and developing that relationship with the team, developing the relationship with the patients and families, it helps tremendously to have that relationship so that they can go forward and know they're supported. I always like to think of it as a safety net, a hammock, if you will, that we provide underneath the patients and the families that help them cope with whatever changes and all changes that are going to come about during hospice.
So if people put the stigma of the word hospice and what it means to them in their mind, which may mean the end is near, and we associate hospice with them receiving the services, and this would be receiving additional specialized nursing care, receiving the medications, medical equipment, supplies related to their loved one's terminal illness, all of this available to them at no cost. A lot of times they will come on much earlier. So we link it to the services that are available to them and that come with that Medicare and insurance benefit once they've been certified with the 6 months. And Kathy will go over that in a moment. But this is why we're here today, ready to educate and share stories with as many of the segments of the population that we can reach. So we can reach people a little bit earlier on, and our whole circle of care team gets the opportunity to do the magic work that they do. So High Peaks Hospice is honored to be your local hospice care provider. Our first office opened in Saranac Lake in 1986. We have since grown to include 3 offices. We cover 5,400 square miles, or 10% of New York State. And here's a map just for a visual. Our offices are located in Glens Falls, Mineville, and Saranac Lake. And the counties we cover include Essex County, Franklin, Warren, Hamilton, Washington, and a little bit of St. Lawrence there. So we have 2 teams. We have it split between a northern team and a southern team working together towards one common goal. We stand ready to come to your home, your nursing home, your hospital room to offer immediate comfort and peace of mind. Put some friendly faces there. So our services are covered. There's no copays or deductibles. Medicaid, as well as most private insurance companies and HMOs, provide the same standard of care as the Medicare benefit. No one at all is refused care due to the inability to pay. And to cover these expenses not reimbursed by insurance, we rely on the generosity of private individuals as well as our community support.
So let's look at criteria for hospice admission. So hospice care is appropriate for any individual, no matter their age, who has been diagnosed with any life-limiting illness with a life expectancy of 6 months or less. So that is the physician, their personal physician, who certifies that in his or her best medical opinion, the patient has 6 months or less to live. And as an FYI, we've actually had patients on service even for a couple of years, which is not the norm, but they were able to qualify through Medicare that they had continual decline. And in my own opinion, there's never a reason once someone is appropriate and for hospice for them not to get hospice care, because we just provide so much support. So we often help patients with late stage heart disease, end-stage heart disease, renal failure, COPD, dementia, cancer, Alzheimer's, for example, are some of the few. And who can contact us? So again, there is no need to wait for a crisis to occur. Soon after a terminal diagnosis of 6 months or less is the optimal time to enter hospice. We do find, and I'm not quite sure right now what our length of stay is, but it's never as long as we would like. If we get patients in and they're only with us for 5 days, we have not had an opportunity for the whole team to do their magic, as Sarah says, and to really help these patients and families out. The longer we have someone on board, the better the relationship, the better care we can provide, the more meds we cover, the more DME. The whole package is just a much better deal when they're on service longer. And anyone can contact hospice to make a referral. Certainly the personal physician, nurses, friends, neighbors, the patient themselves, a family member. What happens when they contact us, then we go and contact their personal physician and get some clinicals on them and see if they review those clinicals, see if they look to be appropriate, and get the physician's order. But anyone can make that original referral. So, and what are some of the reasons to contact hospice earlier? Obviously, more comfort. We provide medications, skilled care, and treatments to make patients comfortable wherever they call home. As Sarah said, most of the patients are in their own homes. Some are in nursing facilities or assisted living facilities, and some are actually in the hospital, where we will go if they have critical symptoms, and we can treat them there as well. Also for more support. We support their needs and wishes and help their caregivers become more confident in the care they provide. So we will teach them how to manage that bedbound patient, or teach them with transfers that are safe, or oxygen safety, or how to give medications when the patient no longer is able to swallow well. We also provide more joy. And some of you may think, how could there be joy in a hospice environment? But honestly, there is joy in that phase. If we can relieve the patient's burdens as far as their physical symptoms, help with that, know that they have support, help their families feel supported, they can find joy even in those last moments. So we connect with them with warm and caring volunteers who provide both friendship and respite. We provide more peace. We provide spiritual and emotional support, allowing peace of mind for the patient and the family. And number 5, we also have more moments. So we create opportunities to continue the best quality of life possible, allowing more precious moments at home with family.
So important.
So what are the signs that it is time to call for a hospice evaluation? Someone who's frequently in the hospital triggers a little red flag, and we may want to look at that and see what is causing this. Increased weakness, and I would say increased debility. Someone who was able to walk, who now is no longer able to walk for any multiple reasons. Decrease, as I said, in the ability to function. So walking, their ADLs, their ability to feed themselves, their ability to make decisions. Progressive unintentional weight loss or weight gain. You know, sometimes with the cancers, or we may see weight gain, although typically you think of weight loss. And that's a clue, and again, a red flag that this patient may be getting appropriate for hospice. Increased oxygen dependency. They are having trouble. They can no longer leave the house, even with the oxygen, perhaps. They're afraid or worried. And just so you know, when we have COPD patients, or any patients actually, we can order oxygen just because they're on hospice. They do not need to have a pulse ox of, you know, less than 88 or 87 or whatever the standard is. We don't require that. We can get we can get oxygen just as a comfort tool. When you see dementia now with the inability to communicate, and often when you see that, you'll also see other measures of decline. Weakness, weight loss, impaired functional mobility, trouble swallowing. So, and again, you may see the whole picture. Sometimes you don't just see these independently, but you see many together. And the preference to focus on comfort care. You know, the classic might be the cancer patient who's had chemo and radiation, continues to have progression in their disease, progressive symptoms, and says, you know what, I'm done. I don't want any more of this treatment because it's making me feel bad. So any and all of those may clue us in that it's time for a hospice evaluation.
And in addition to a formal hospice admission, we offer educational sessions, like informal, just ahead of time. If you're interested in having it, what that looks like is that you call us, say you like some information, you'd like to request this, you know, an informal evaluation, and our team will connect with you, sit down, learn about your situation, explain our services, and then you can decide whether it's appropriate to try to begin now, or, you know, it's just knowledge for the future. It's never too early to learn, so you can make an informed choice. And social workers and the team, one of the early benefits is that they can help the family members get on family medical leave, or we can fill the practical needs like a hospital bed or DME or a wheelchair in the home, or having nurses go to the home so people don't have to struggle to get to a doctor's appointment because it is in home where we come to you. And other times it's just being there to support the family. So I really recommend the informal family informational session that we offer. So the most misleading myth about hospice care is that hospice is about dying, but nothing could be further from the truth. So the founder of the modern hospice movement, which was just in the early 80s, we're not going back too long here, but Dame Cicely Sanders once wrote, "You matter because you are. You matter to the last moments of your life, and we will do all we can, not only to help you die peacefully, but also to help you live until you die." And words from a family. The people from hospice were angels. They gave us more help caring for Mom than we ever thought possible. They set up her medical equipment in her bedroom, prepared us for what to expect, and even ran errands. It freed our family to spend time together in the time Mom had left. So every hospice experience is unique, but the one thing families tell us the most often is that we wish we had called hospice sooner. And as we come to the conclusion, we just want you to remember that we support you. Remember that you, your family, and your friends have options when it comes to end-of-life care. We're available as a resource to you now and in the future. We partner with local hospitals, nursing homes, schools, and funeral homes as a resource to the community. And we help achieve a better quality end of life and peaceful passing. We offer no cost bereavement support and programs to anyone in the community who needs it, including children. Our bereavement support, once again, it's offered to anyone in the community who needs it. We can go to nursing facilities, long-term homes, or just a general family member. No hospice affiliation is needed, and we're only a phone call away.
And I don't know if you're aware that our bereavement services actually extend for 13 months post-death of the individual that's on our service. So it's a very extensive program, and people can take advantage of it to whatever degree they like, whether it's just phone calls monthly, or it's coming in for group or more intensive. Sometimes bereavement will even meet in someone's home. We've actually even done bereavement before someone has passed. When we've had, I can think of a patient I had, for example, a young mother with 3 children, and we got bereavement in sooner, which was very valuable for the kids in the family when mom had passed. So we're very willing to work with patients and families.
And this is our mission statement. High Peaks Hospice provides end-of-life care that listens with respect, cares with compassion, supports with choice, and comforts with understanding wherever you call home. And I'm just happy to report that this year, through the end of November, we have served 590 families throughout our service area that we showed you. So I can add a link to resources to anyone interested in the chat. You can also send me a chat or send us a message, put your name in, and we'll be happy to connect with you individually and give you any resources that you want. But help us spread the word. We truly appreciate it. I'm going to turn off the video, and then we'll open up for any questions for a few minutes.
Residential services at Warren Washington Association for Mental Health. And like Cynthia said, we have a steering group, I like that term, to essentially identify the barriers that we have between our long-term care in the area and our clients with mental health diagnoses. Identify those barriers, break down those barriers, try and figure out some workflows to make sure that everyone has what they need, not only the client, but the providers involved as well. So some of you may remember that Cynthia had sent out a survey a couple months ago to all of the providers, the long-term care providers in the area. So right now, what we are working on, and this is just going to be a little brief update because we haven't made a ton of progress, but we're doing baby steps, which is awesome. So we've got those barriers now, those troubled spots that the providers have identified through the survey. And so what we're doing is reaching out to all of the providers that participated in the survey and trying to get a one-on-one with them, whether that's in person, over the phone, or via email, to really drill down what their issues are and how we can help with that and how they can help us, kind of thing. So working on that, we are hoping to have that completed by the end of January, beginning of February, having everyone touched base with and some good information from that and some good feedback. Cynthia and I have been reaching out to, there's actually a program in Massachusetts that kind of already has this in existence. So her and I are reaching out to them, trying to kind of get an idea of what they're doing and how they're doing it, how they're functioning, how they got it up and running, where the funding is coming from, and to see if we can maybe replicate that in our area rather than reinventing the wheel. So on our end, we internally, our steering group will be meeting again in January to kind of nail everything down in terms of the local providers and come up with a list of people who we feel would be appropriate to be in a large group meeting with us. So right now we're just kind of internal with Cynthia. We've pulled in, so it's just a little small group of us trying to figure this out. And by the end of January, we'll have invitations out to community providers that we feel would be good to have at the table to try and figure this out. So in the meantime, our agency is putting together a small group of internal people to kind of look at the clients that we already have that are in need right now of those long-term care services, and just reach out to the community providers individually that we think would be beneficial for our clients to be set up with, and kind of go from there until we can get that big picture kind of up and running. I think that's really where we're at right now. The biggest thing being that we're trying to get each of those long-term care providers nailed down individually and either eyes on or email with to get some specifics from them. Does anyone have any questions about that? It's like I said, quick update, but it's definitely, we're definitely moving and making some progress, which is great because we've been kind of at a standstill for a little while now trying to figure it out. Or if anybody has some suggestions on which direction we should be going in, that would be great too.
And again, we'll be adding the minutes. Those will go into the next long-term care newsletter. So you'll be able to kind of see, here's where we're at, and if you were like, hey, I have a lot of really good ideas, I would actually like to be on the committee, please reach out and let us know. You know, where the goal obviously is some concrete forward movement. So and we definitely have, you know, started doing that, which is great. It's just everybody, you know, the need has been here for a long time. So, you know, it would have been great to have done this yesterday. We're doing, you know, but there are many moving parts, as everybody knows, which is why we've needed it for so long. So there definitely has been progress and forward movement. It's just we're hoping for more. So thank you,
Just a little
Lisa.
bit complicated.
It is a lot complicated. Yes, there's so many. There are so many moving parts to that. So yeah, thank you, Lisa. Thank you so much. I don't see any questions in the chat. But again, at any point, like I said, the minutes will be in the newsletter, and also, you know, you can send something in the chat, and Lisa's information will also be in the minutes. So you'll have that as well.
As well as on the Member Planet, my email's on there as
Exactly.
well. So
thank you for that, Lisa. I always give a little plug for Member Planet. If you are not on Member Planet, then that's the way that you will receive future emails and information and all of the things that are happening in this group, which quite frankly is a pretty dynamic group. There's a lot of really cool progress that happens in this group. So, which is really exciting to see. Currently I'm doing the newsletter. So just the really cool information that kind of, you know, comes through. There's a lot of great things happening here, which is really exciting. So thank you so much, Lisa. Okay, and our last presenter is going to be consumer directed choices. And I think it's going to be Chris.
Hey, yep.
Hello, Chris, how are you?
Good, how are you?
I'm great, thanks. I'm going to go ahead and hand you the floor. Chris is with Consumer Directed Choices. Welcome and good morning.
Good morning. So we have a presentation. I'm just going to wait for the host.
You should see a share screen at the bottom of your.
Got it. Everybody see it?
Looks great.
Awesome. Thank you, everybody, for your time. Thank you for Cynthia and the Long-Term Care Council members for the invitation and time today. My name is Christopher Graber, and I am the CEO of Consumer Directed Choices, or what we call CD Choices for short. How my life journey brought me to CD Choices is somewhat unique, and I believe to be my destiny or life purpose. Throughout my life, I always wanted to make a difference, and I just didn't know what exactly that was at the time. Growing up, I also wanted to be a professional baseball player, and however, while attending Siena College, I was diagnosed with an illness that ultimately led to a surgery and the need for traditional personal care to come to my house for about 3 to 4 months and pack a wound. The aide was a younger woman who came to the house in the wee hours of the morning. She saw me in a vulnerable state. And at that point, during that 3 to 4 months, I wish I had more control of who came into my house and who touched my body. Ultimately, the experience provided an unusual lens into the reality of what it's like to have a total stranger come into your home and help you with very personal daily care. Luckily and fortunately, my health did improve, but the experience left a permanent impression on me and motivated me to seek a career helping others that require home care. I found that opportunity at Consumer Directed Choices. I've been employed with the organization for 15 years. I started as a bookkeeper back in 2006. I was promoted to CEO back in November of last year. And prior to that was the organization's chief financial officer for about 10 years. I will now hand it over to Katie.
Hi, good morning, everyone. Thank you so much again, as Chris said, for the invitation to be here and share information about CD Choices. My name is Katie Proctor. I'm the Director of Programs here and pretty new to the organization. I actually started in September, so about 3 months ago. And my role here is to oversee the program department and ensure that our customers, whether that be consumers, personal assistants, or our community partners, really receive exceptional customer service. I come to CD Choices from a very different background. So I actually spent 11 years in higher education administration, working for a private college here in the Capital District. So I always get the question, why? Like, why the change? Why the move? When I was working in education, what I loved the most, and I still love about it, is that it has the ability to impact lives. It has the ability to change lives. And in my role, specifically in career services, it was very rewarding to watch someone make a transition in their life and go a different direction. So I'm happy to say that I'm able to do that here, but in a different way. So I still believe education has the power to change your life. That will always be in my blood. But now it's about, helping consumers understand their options, understand what's available to them. It's about helping a potential personal assistant understand what are the options for me for careers in home care. What does that look like? I don't think that people have a good understanding of that. So I'm still educating, but in a different way. And again, just thank you again for your time. We're really happy to be here and share our organization with you.
Good morning. I'm Brian Frazier. I'm the Chief Financial Officer at Consumer Directed Choices. Pardon me. I've worked in healthcare organizations for most of my 30-year career, including larger hospital systems, and the last place before Consumer Directed Choices was a certified home health agency. So it was basically an agency like the one I worked at that would send aides to people based on our own schedule. And when I came to Consumer Directed Choices, learned the philosophy of self-direction and flexibility that it gives the consumer, I really fell in love with it, because instead of my staff saying you can send your aides at a certain time, you got to be there at 9 o'clock. I don't care if you got to go to work. You're still getting up at 9 because that's when we can get somebody there. The consumer can hire somebody on their own, and they may need to get up at 6 o'clock in order to get to work at 9 o'clock. So it just provides them flexibility. It provides them the ability to stay in the community, stay active in the community. So I just am very excited, even after 4 years, to to still be working with consumer-directed choices.
Morning, everyone. My name is Hongwei Zhang. I am the Director of Operations here at City Choices. I've been with City Choices for about a year. Prior to coming to City Choices, I worked for one of the local ARCs, one of the ARCs, for about 8 years. So I always had a passion to help seniors, people with disabilities. And it's been an honor today to be a presenter here this morning.
Thank you, guys. So City Choices was founded more than 2 decades ago in January 1997 by the late Constance Lehman as a not-for-profit corporation for the sole purpose of advancing self-directed programs and community-based supports to empower people to choose their own care. The organization was founded by people with disabilities, and our board of directors is comprised of local leaders, knowledge experts, and we're really proud to say that over 50% of our board of directors are either program users, program user representatives or surrogates, or people with disabilities. I do want to spend just a few minutes talking about Constance because she means a lot to everybody in the organization and in the community. And if it wasn't for her, we wouldn't be presenting to you all today. So in 1984, at the age of 17, Constance sustained a spinal cord injury, which made her paralyzed. She then enrolled to Schenectady Community College in 1989. And at that time, she believed her only path to empowerment and a fulfilling life would be through education. She discovered her life's work after she accepted a job at the Capital District Center for Independence. She learned about consumer-directed care, which is an alternative to traditional home care, through her new position, and helped develop a personal care program, which we now know is consumer-directed personal assistance. And that offers people with disabilities more autonomy in their own care. As a user of CDPA, which is the acronym herself, Constance saw firsthand the power of self-direction model. After fiscal problems occurred at the organization or center that she worked, her job ended, but she refused to give up on the idea of a self-direction model. She volunteered her own time and money and ultimately began laying the groundwork for what we now know as consumer-directed choices. She started the organization along with 2 other individuals living with a disability, and she incorporated CD Choices, and we became operational in December of 2001. Constance firmly dedicated to CD Choices, to the cause, to CDPA, and as others learned how self-directed model worked through their independence, CD Choices flourished. Unfortunately, Constance passed away in September 21st of 2012, and she was 46 years old. Constance was an example of both determination and self-determination. Although her life work was short, hers was a life worth living because she chose to make it so. And by example, indeed, the lives of many others are better as well. As I mentioned, we continue today to be run by people with disabilities and advocates who share Constance's dream of changing the way home care services is delivered. Our philosophy is really represented in 3 core elements. Self-direction is a model of long-term care service delivery that helps people of all ages with all types of disabilities maintain their independence at home. When a person self-directs, they decide how, when, and from whom their services and supports will be delivered. A person-centered approach is where the person is placed at the center of the service and treated as a person first. The focus is on the person and what they can do, not their condition, nor their disability. Support should focus on achieving the person's aspirations and be tailored to their needs and unique circumstances. We believe what separates CD Choices is the third, which is the consumer, which is the person with disability or a senior, is the employer. Eligible consumers in our programs directly employ and supervise personal assistant workers to help them with medical and personal care. So instead of being dependent on decisions by strangers, consumers using the self-direction programs by law and regulation have complete control over recruiting, hiring, training, supervising, and if needed, terminating their personal assistant workers, which allows for a level of freedom and independence unheard of under traditional home care models. Our core values, the 6 that you see on the screen, we use these to make our hiring decisions. So if you fall into these buckets, there's a good chance that you'll be, hired or go through the second round. But if not, there's a stalemate there. So excellence. We strive to provide unmatched customer service, operating with maximum efficiency, quality, and compliance. Inclusiveness. We play an active role in our vision of an inclusive world by ensuring people with disabilities and their families are involved in the operations organization at every level. Innovation, which we'll hear later in the presentation. We continuously seek and pursue new ideas and opportunities to enhance our programs for consumers and to be a leader and a model for other fiscal intermediaries and organizations. Integrity, we're dedicated to staying true to the self-direction model, which I hope you guys have seen thus far and continue to see in the rest of the presentations, and having a strong corporate compliance program in place at all times. Respect for individual dignity. We believe that people with disabilities have the right to make their own choices about their own lives and take ownership of the outcomes of those choices. In other words, dignity of risk. Self-determination. We believe that people with disabilities are in the best position to make the choices and decisions for themselves. And I'll hand it over to Katie.
Thanks, Chris. So I wanted to provide everyone here today some demographic information about our makeup. As Chris mentioned in his section for the board of directors, currently we have 14 that sit in that spot. And Chris has done a phenomenal job of restructuring that, rebuilding that in the past year. And please correct me if I'm wrong, I think it was about half that size before, and the makeup of it is diverse. And as Chris mentioned, includes consumers, designated representatives, and professionals from a variety of industries. So great job there, Chris. Our office staff, right about 34 individuals in a handful of departments. So, we have obviously a finance department, programs department, operations, and administrative support. And we're growing. Actually, I'm looking for another person to join my team as we speak. Right now, we offer services for 3 different programs. So as we've been talking about, the Consumer Directed Personal Assistant or CDPA program, the ISIP program, which is the expanded in-home services for the elderly, as well as respite. And I'll get into a little bit about those in a moment. We currently have about 26 contracts from a variety of funding agencies and community partners, which include local departments of social services. I think there's about 13, please, Chris or Brian, correct me if I'm wrong, as well as managed care organizations and some Alzheimer's associations in New York State. Some examples of our payers would be names like Fidelis, CDPHP, MVP, Nescentia, Eddie Alzheimer's, just to name a few. If you're looking at the section, actually, I'll get to that in a moment, the geographic service area, I do think it's important to note that CD Choices actually started offering services in just 2 counties. So out of the 62 counties that make up New York State, now providing services in 55 of them. So that's just, again, speaking to the growth of our organization and what we do. Looking at the revenue section as far as audited and planned, the key takeaway here is growth. We have been working really hard to increase our visibility in the community and across New York State. Hong Wei and her team have done a tremendous job improving our marketing. selecting the appropriate firms to assist us in spreading the mission, spreading the word, getting the message out about what we do and what personal assistants do and why their work is so important. You may have seen new commercials, bus tails, not trying to steal your thunder, Hongwei, Facebook, LinkedIn posts, again, working really hard to spread the word and get the message to as many ears as we can. And then looking at the numbers there, again, you can see them off of the slide, the number of consumers served, the number of total personal assistants, and those who are active at this moment. So as I mentioned before, right now we have 3 programs that we currently offer fiscal intermediary services for. The big one for us is our Consumer Directed Personal Assistance Program. So CDPA is a statewide Medicaid program, and it provides an alternative way of receiving home care services. So, I don't need to repeat what Chris had already mentioned, but it gives the consumer more control over who is providing their care, how their care is provided, when it's provided, to seniors and individuals living with a disability, obviously those who are eligible for the services. And really the program was created to empower choice, freedom, independence in how seniors and individuals with disabilities receive care and how they ultimately live their lives. Rather than assigning a home care vendor or an agency that would, again, as Chris mentioned, pick the person coming to their home, set the schedule, tell them, this is when they're coming, the consumer has the ability to do those things, to select their people, to train them accordingly. They're also responsible for items such as approving timesheets and termination if possible. So they have the ability to do all of those things as an quote unquote employer. Although CDPA is our primary program, as I mentioned, we do have 2 others, which are the ISIP and respite programs. The ISIP is designed for Medicaid ineligible individuals who are at least 60 years old and need assistance with the instrumental activities of daily living. And those tend to be more complex and require a little bit more thinking. ISIP focuses on empowering the older adult population and allowing them, again, to have more control over the type and quality of care that they receive from their personal assistants. The funding for that is provided through the New York State Office for Aging and is administered by a local office for the aging, but not every county has a consumer-directed model. And last but not least, the respite program. We offer FI services for respite consumers currently through our Eddie Alzheimer's Association and the Alzheimer's Association of the Hudson Valley, which totals 17 counties in New York State. Similar to ISIP, this is for non-Medicaid individuals, specifically those living with Alzheimer's or other dementias. The consumer's primary caregivers, obviously, are those who are doing the recruiting, the hiring, the supervising, and discharging of their respite workers. And this program was designed to provide periodic relief for those primary caregivers, while also providing intermittent care for the individual living with dementia. Funding for the respite program is provided through New York State Department of Health grant, which is entitled the Alzheimer's Disease Regional Caregiver Support Initiative. And the key connection with these 3 programs is that they all fall under the self-direction model.
A recent survey has shown that most consumers choose their fiscal intermediary because of pay and benefits. So that's why we want to put as much of our funding sources into the pay and benefits. We offer a weekly payroll. When we implemented it, I was not the most popular person in the office, but it does better match the work that the worker is doing to the pay that they receive. They're getting paid the following week after working. And it really helps the people who work sporadically because they don't have to wait a couple of weeks after they've got done working. A recent study showed that 2/3 of New York, of a recent study of fiscal intermediaries in New York show that 2/3 of the consumer-directed personal assistant workers make minimum wage, $12.50 an hour. We, pardon me, we've made a concentrated effort to make sure that we pay for every different payer for every different county above the minimum wage. And our current average pay rate is $14.01. As minimum wage increases to $13.20 at the end of this month, we'll be increasing the pay ranges for the consumers to give in early 2022. The paid time off, we've offered that for years. Recently, New York State said that all employers have to offer this New York State sick leave, but we've been doing that for a number of years. Most fiscal intermediaries do not permit overtime, or if they do permit overtime, it's because of an emergency or with restrictions. We permit overtime unrestricted, but we do encourage the consumer to make sure that they have enough coverage in case that person that they trust, they want in their home gets sick or needs care themselves. This lack of overtime restriction really has helped our consumers during the COVID pandemic, when they only want to trust 1 or 2 people to come into their home so that they don't get sick and they don't bring COVID into their house. We have offered year-end bonuses for consumers to give to their personal assistants for the past 15 years. And recently, in an effort to increase the number of workers per consumer so that they have enough coverage, we've offered or implemented a sign-on bonus that goes through the end of this year, where a consumer can give their personal assistant up to $500 for full-time work. And we leave the entire implementation of that program to the consumer. They just tell us when they want to pay their worker that they've just hired, and we'll get the payment out to them. And finally, we offer the standard health and dental benefits that other people don't. One of our innovations is the ability for, pardon me, I got my booster shot 2 days ago and I'm getting congested. One of the innovations is to allow the consumer to set their pay range for the personal assistant. We're entering a world where Medicaid managed care organizations and the federal and state government are looking at quality measures and value-based purchasing. A significant component of managing the performance of a consumer's personal assistant is their compensation. The consumer pay range program matches the value and philosophy of the self-direction and person-centeredness. Consumers are in the best position to determine what is best for their care and their independence, including how their personal assistants are paid. The consumers or their designated representatives have the authority to control their consumer-directed personal assistants' compensation and benefits, and make the choice about setting their pay. We do not doubt the capabilities of the consumer or designated representative who comprise the consumer-directed personal assistance program, nor how the consumer-directed personal assistants they will employ respond. The dignity of risk defined is the capability of making informed decisions. Each consumer's pay range ceiling is explained below and is dependent on the consumer's managed care organization or the local Department of Social Services. So, and if a consumer decides that they want to pay below the ceiling, say it's a $14 ceiling, and they want to pay their worker $13, which still is above the current minimum wage, every hour that worker works for them, they accrue $1 for bonuses. And they can give that bonus out at any time. If we have a snowstorm and 2 workers have called out and this other worker comes in, they can give that personal assistant a $50 or $100 bonus if they choose. And they can also reward their workers by giving them pay range increases at any point up to that ceiling. So they can start somebody lower at $13 an hour. And then after 6 months, if they're really working out and they want to reward that employee, they give them a 50-cent increase in pay. That way, the worker feels empowered and embodied to do a great job, and the consumer can reward their workers.
Hi, so first of all, I'm very excited to be here to talk about our innovative workforce recruitment portal today, this morning. So what is City Choice's workforce recruitment portal? As you know, healthcare worker shortage have been an issue for a lot of us. I'm sure some of you, your organizations have lived that as well. So you feel the pain. So City Choices, we had this recruitment portal for a couple of years. What does it do? So first of all, it offers our consumers the ability to search for potential workers within this portal. Consumers can also post jobs within the portal. And on the other end, potential caregivers, if they have a profile within this portal, they can search for the jobs that the consumers posted. Like I said, we had this portal for a couple of years. We received many feedbacks, luckily, from consumers and users who use this portal. So according to those, we made tons of enhancement and features improvement to make it better, to make it more user-friendly for our consumers. So the newest version launched on November 1st, just about a month ago. And around the same time, we launched a bunch of recruitment-focused marketing campaigns that includes bus tails, newspaper ads, Google ads, TV, radio commercials to attract potential workers to create a profile into this workforce recruitment portal. So I just, although we only launched this newest version for about 30 days, but we have seen some very good outcomes that I wanted to share with you. So first of all, consumers who use this workforce recruitment portal recruit twice as many new potential personal assistants than those who do not use this portal. And this morning, in preparation for this presentation, I went on this portal and entered in one of the zip codes in Washington County, and we had over 100 active potential caregiver profiles within this portal. Within the first 30 days, there were over 1,800 messages exchanged between the consumers and those potential workers within the portal. Searches performed on a daily basis, that was over 150. That could be a consumer search for a potential worker within the portal, or this potential worker search for jobs. Next slide, please. So this slides talk about some of the benefit and features of this new portal. I actually not going to go over every single one of this because I'm going to give you instead in the next few minutes a live demonstration of this portal. So let me just switch my screen into the portal. Chris, you may have to stop sharing.
Still shared? There you go.
Okay, so you should be able to see my screen, which is a website, our City Choices website on the screen. So they can access this portal via the link here. So for anyone who's not a current user of this portal, they can sign up for a profile. It is now available for CD Choices consumers or employers. However, anybody can become a personal assistant within this portal by clicking on this link here. So let me just log in as if I were a consumer. So you can see what the consumer will see when they log in into this portal. So in the profile screen, consumers can easily update or edit their information, such as their contact information, addresses, password, and other stuff. In the search for PA screen, they could, consumers can put in filters to search for their potential PAs. Examples including times, skills that they require for the personal assistant, the language that the personal assistant would need to speak, and others. They could also search by location radius from their home addresses and then set distance per their preference. I also wanted to note that, we understand that some consumers we serve do not have technology access, so they cannot use this portal. So all of the admin staff and program staff here at CD Choices are trained to know how to use this portal, and they can help the consumers over the phone by putting in their preferences and perform the search for them. And and after they perform all the searches and generate this potential list of PAs, personal assistant, they could download into a list and mail that list to the consumer, so they can contact those potential personal assistants themselves. The other feature, while they're searching for workers within this portal, they could message this potential worker right in this portal. And once they do that, send the message, on the other end, the personal assistant will receive the message instantly on their email. And if they choose to, they could also change that to a text message alerting as well. So not only the consumer can search for personal assistant within this portal, they could also post for jobs. They could post one or multiple jobs by going into a very easy window, put in their job posting, give it a little description of what they need for this specific shift. They could give it some more criteria so the potential worker know exactly what they're looking for, as well as if their shift have a specific time requirement, they can put that in here as well. And as soon as they hit add this job, this will be a job posted within this portal, and all the personal assistant in this portal are able to view this job. If they're interested, they could message this consumer directly within this portal. So for consumers whose primary language is not English, we also added this instant translator tool so that they could translate all the pages into their native language for the ease of use. And in 2022, our organization is trying to explore the possibility to licensing this portal to organizations who may be interested in utilize this feature or the database of this portal. So more improvements to come. So with that, that concludes my brief demonstration of the portal.
Wait, you may have touched upon this, but if a consumer does not have internet access or perhaps is not tech savvy, do we have the capability of assisting those?
Yeah, I, like I mentioned, if they can call us, City Choices staff can put in their criterias and then download them into a list and mail that to the consumers. For sure, yes, good question.
I'll share my screen one more time. Nope.
Yep.
Okay, you got it. So that concludes our presentation. Really want to I think we ran a little long, but hopefully you guys think this was useful information, and happy to take questions. We could also provide members any of the 6 elements that are on the screen for our collateral, our marketing assets, or schedule a presentation if needed. So just hand it over to the members. Any questions?
Thank you so much. This was very, very good. Thank you so much. Gina says, thank you. Phyllis says, awesome.